Leopold's maneuver is a systemic external palpation of the maternal uterus through the abdominal wall to determine the following: number of fetuses, presenting part, fetal lie, fetal attitude, degree of descent of the presenting part into the pelvis, location of the fetus back to assess for fetal heart tones. So we have here the four maneuvers. The first maneuver, this maneuver identifies the fetal lie. It may be longitudinal or transverse, and the presenting part may be cephalic presentation or bridge presentation. The second maneuver, this maneuver validates the presenting part by locating and palpating the smoother contour of the fetal back using the palm of one hand and the irregular small parts of the hand, feet, and elbows using the other hand. The third maneuver determines the part that is presenting over the true pelvis inlet by gently grasping the lower segment of the uterus between the thumb and fingers. It also assists in identifying the descent of the presenting part into the pelvis. The fourth maneuver, this maneuver determines fetal descent. Good attitude if brow corresponds to the side or second maneuver that contained the elbows and knees. Poor attitude if examining fingers will meet an obstruction on the same side as fetal back or hyperextended head. It also palpates infants antero-posterior position if brow is very easily palpated. Fetus is at posterior position, occiput pointing towards woman's back. So the first thing that we are going to do is we have to knock on our patient's door and introduce ourselves.
Okay, first is the assessment. We have to ask the client last menstrual period, and then obtain the client's vital sign, and this is for baseline data and for also to be able to calculate the age of gestation. And for the planning is we have to wash our hands thoroughly. Washing prevents the spread of possible infection, and also explain the procedure to the client and instruct the client to empty bladder, provide privacy, ask the client to assume in a dorsal recumbent position with knees bent. Okay. Hi ma'am, pwede na ko makuha imong name?
Jackie.
Hi ma'am Jackie, kano sa imong birthday?
March 9.
March 9. Ikaw si Ma'am Jackie, dahil mo ang birthday kay March 9. Ngayon, ma'am, nanong ko'y koan niya. Itong buhaton karon magnatay Leopold's maneuver. Kani siya, ma-determine na ito kung asa na ang position sa imong baby ato siyang impalpate, okay? Operate lang ito, mama, or madali ta. And before that, ma'am, mag-ask na ko, ma'am, kano sa imong last menstrual period? Nakahinumdum ka ka?
Sa February 3.
February 3 mo last menstrual period. So, ang expected date sa imong delivery is karong November 10. Okay? Kano sa nangihi na ka? Kano sa kalas nangihi?
Gini
Di na ka kalion?
Di na.
Okay.
After placing our patient in a dorsal recumbent position with knees bent, we have to proceed to the implementation. First is we have to drape our patient properly. This is to prevent undue exposure of the patient. Stand at the foot of the client facing her and place both hands flat on her abdomen. Palpate the superior surface of the fundus. Determine consistency, shape, and mobility. When palpating, a head feels more firm than a breech. A head is round and hard. The breech is less well-defined. A head moves independently of the body. The breech moves only in conjunction with the body. Face the client and place the palms of each hand on either side of the abdomen. Palpate the sides of the uterus. Hold the left hand stationary on the left side of the uterus while the right hand palpates the opposite side of the uterus from the top to bottom. Then hold the right hand steady and repeat palpation using the left hand on the left side. This method is most successful to determine the direction the fetal back is facing. One hand will feel a smooth, hard, resistant surface or the back, while on the opposite side, a number of angular nodulations or the knees and elbows of the fetus will be felt. Gently grasp the lower portion of the abdomen just above the symphysis pubis between the thumb and index finger and try to press the thumb and finger together. Determine any movement and whether the part is firm or soft. If the presenting part moves upward so an examiner's hands can be pressed together, the presenting part is not engaged. If the part is firm, it is the head. If soft, then it is the bridge. Face the feet of the patient. Place fingers on both sides of the uterus approximately 2 inches above the inguinal ligaments, pressing downward and inward in the direction of the birth canal. Allow fingers to be carried downward. This maneuver determines fetal attitude and degree of fetal extension into the pelvis. It should be done only if the fetus is in cephalic presentation. Information about the infant's anteroposterior position may also be gained from this maneuver. A rule of determining the duration of pregnancy by measuring the height of the fundus of the uterus above the symphysis pubis. Locate the fetal heart tone. Count fetal heart tone for 1 full minute. To locate fetal heart tone depends on fetal position. To assess and listen for normal heart sounds and rhythms, the normal fetal heart tone is 120 to 160 beats per minute. Fetal heart rate variability is one of the most reliable indicators of fetal well-being. For the evaluation and documentation, distinguish maternal from phonic shuffle, record findings, identify any abnormal findings, and record or document it.